I'm Naeem Douglas for Metro Focus. The opioid epidemic is wreaking havoc in communities across the country, including right here in New York City. Tonight on Metro Focus, we take another look at Staten Island, which has been hit particularly hard. It's the smallest of the 5 boroughs, but has the #1 opioid-related death rate. Now, community members over the last few years, along with law enforcement, have been taking a new approach to try and combat the disease of addiction, and it looks like they could be getting some results.
For a person like me, and somebody that was an addict and struggled for so long, we see somebody overdose, that means it's something good, and we try to get our hands on it, and that's horrible for us. As bad as it sounds, that's what we looked for.
George Saliva is a coach at Carl's Recovery Center. The group is one of many on Staten Island aimed at helping fight the opioid epidemic gripping the borough. The crisis has been brewing for quite some time on the island. In the early 2000s, abuse of prescription painkillers went rampant. But in 2012, the I-Stop law passed, making it harder to go doctor shopping, which is the practice of going from doctor to doctor to get pain medicine, such as OxyContin.
Basically, the gig was up. And as great as that was and needed to be done, there's pros and cons to everything. Because of that initiative and that legislation being pushed through, it went from prescription painkillers to heroin.
Heroin turned out to be cheaper and more easily available. Add fentanyl, a synthetic yet potent opioid, and you have a recipe for a spiraling crisis.
To me, it's crazy because I had a cousin pass away and a neighbor, and my cousin was 18 years old, and my neighbor was maybe 27 when he passed away.
Unfortunately, it's a problem that's been seen before. A wave of heroin use swept through the country in the 1970s and 90s. With a green light from the White House, law enforcement responded harshly with stiff jail sentences for dealers and users. But today, a different approach is being used to tackle the problem.
You need a menu of options. That's what we've created on Staten Island.
Staten Island District Attorney Michael McMahon, a former Metro Focus guest, made the opioid crisis a top priority for his office 2 years ago.
The spike in deaths nationwide is a national concern. We lose more people in this country today from drug overdoses than automobile deaths and gunshot wounds combined.
His office, along with the NYPD, are taking a little bit of a different approach to the crisis. They're now treating overdose cases as a crime scene, trying to find out where the drugs came from, going after heavy traffickers, and offering another route for those caught in the clutches of addiction.
People who are arrested on low-level misdemeanor possession charges, we offer them diversion at the time of arrest out of the criminal justice system, as long as they pursue some meaningful engagement as prescribed by the professionals. We will not prosecute them for those cases.
Preliminary numbers from the DA show 338 people have been offered the deferment program dubbed HOPE. Out of those, 263 have participated since its conception in 2017.
How do you, talk to the people that come through here about that?
Like a human being. It's just that easy. We're not here to judge. We're not here to discriminate. I talk to anyone who comes in here the way that I would want to be talked to if I was struggling with something very, traumatic in my life.
Jill Schlossberger is the project director at Community Health Action of Staten Island. Her group works with the district attorney's office, so when an opioid-related or overdose call comes in, a peer mentor is sent out.
Good afternoon, next up. I always wanted to be a counselor. I didn't think that it would be possible. I thought I was just too far gone to achieve that. But I like being a peer because it's different from counseling as far as it's not so clinical, it's more raw.
Jason Pisano is one of those mentors. He's in recovery himself and doing his part to help others.
When we're talking and I say, listen, I was on drugs for 17 years. I overdosed, 4 years ago. And they look at me and say, wow, you? Wow, I would have never guessed that. I'm like, yeah. And immediately it breaks down this wall of feeling, okay, well, now I can tell this person anything. They know where I'm coming from. If I share some stuff with them, some personal issues, they're not going to judge me. It's just a better understanding of each other, and I think that's important.
The hard work appears to be paying off. In 2016, there were 116 fatal overdoses in Staten Island. Early numbers show that overdose deaths dropped to 99 in 2017. That's about a 15% decline.
And that's something that we think that it's because of all these different efforts with our different partners in Staten Island that has proven successful, or at least hopeful, I should say, because it's still, let me be very clear, it's still a raging 5-alarm fire.
A fire that's getting attention from all angles, including an added push for opioid awareness and emergency treatment.
Narcan, naloxone is more accessible now. People didn't even know what Narcan was, you know, even 3 years ago.
For some of those who don't know, naloxone is a life-saving drug that can be administered when someone is in the midst of an overdose. Training takes only a few minutes. Jason walked me through the steps.
What you kind of hear about is that you give it to them and it's almost instantaneous. Is that the way it is, or it takes?
I think it depends on the person, especially with fentanyl being found in, you know, the heroin now.
For those on the front lines who live with substance abuse, they applaud this new approach of putting the focus on the disease and lifting the shame of addiction, which kept some people in the shadows.
Are you ever going to win the war on drugs? No, and I'll say that to anybody. How you can really help it is changing the stigma of addiction. You know, we are not what the movies make us out to be, and what I was told as a kid, that it's the person with the brown bag drinking the alcohol, or the skingy people to society. I mean, they're doctors, lawyers, teachers, brothers, sisters. We are everyday people.